And thank you all for staying till the end of the day. I know some of you are jet lagged. I'm feeling a little bit too. I'd like to acknowledge my colleague Michelle Kipke from Children's Hospital Los Angeles and USC, who's a collaborator on this paper. Michelle and I have been working together for 7 years now, and she's been a wonderful colleague and mentor to me. The title of our talk is Associations Between Gay Community Venue Network Position and HIV Risk and Protective Factors Among Young Men Who Have Sex with Men in Los Angeles County. And I'll refer to this group as YMSM throughout the presentation. Just to give you a bit of background on HIV in Los Angeles County, we have about 2,000 new HIV diagnoses every year, and about 84% of those are among men who have sex with men. About 2/3 are among those ages 20 to 39, which means age of infection was likely in late adolescence, early adulthood for many of them. As has been noted by many others, substance use is a major driver of HIV infection among young men who have sex with men. And social venues in which YMSM socialize, like bars and clubs, may facilitate substance use and sexual risk behavior. Something that seems very intuitive and we'll explore further today. So gay male social contexts are interesting places. This is a picture from the Abbey in West Hollywood, where the go-go dancers are literally dancing on the ceiling. A place that can be a lot of fun and represents an important social context in the development of YMSM as young men come to engage with the gay community. They often find themselves in venues such as this. And so we had two objectives of our present study: to document the network of popular gay community social venues among YMSM in Los Angeles, and to examine the relationship between attendance at gay community social venues and both HIV risk and protective behaviors using a type of network analysis called two-mode network analysis, or venue-based network analysis. The data for this secondary analysis comes from Dr. Kipke's Healthy Young Men study, which was a longitudinal study of young men in Los Angeles. Recruitment started in 2005, and participants had to be 18 to 24 at baseline, identify as gay, bisexual, or uncertain about their sexual orientation, or have had sex with a man in their lifetime, and be a member of one of three self-identified racial ethnic groups: Caucasian, Black or African American, or Latino, specifically of Mexican descent. And participants had to be residents of Los Angeles County and expect to live in the county for at least 6 months following baseline. The variable that we used to create the venue network was very simple and straightforward. We asked young men, please tell me the names of the 3 favorite gay places that you go to. Name generators are best if they're simple, and we can debate the utility of that name generator during the question period if you'd like. We looked at outcomes both in terms of substance use and sexual risk behavior. A multitude of questions were asked, and for this study we focused on substance use in terms of past 3-month marijuana use, illicit drug use, which could be any illegal substance, and club drug use. Club drugs included cocaine, crystal or methamphetamine, ecstasy, poppers, GHB, ketamine, and other forms of speed. For sexual risk behaviors, we looked at number of recent sexual partners within the past 6 months, recent STI infection, also past 6 months, and recent HIV testing, which was within the past year. To identify core versus periphery venues in our network, we used a type of network analysis called K-core analysis, and then very simple bivariate statistical testing at the individual level aggregated up to the venue. And I'll talk more about that in a second. So these were the characteristics of our sample. 484 of the 526 men interviewed for the Healthy Young Men study answered that question about popular social venues. The mean age was about 20. About a quarter were African American, and the remainder of the sample was split between Latino and Caucasian young men. 3/4 were gay identified, and almost 90% either were in school or currently working. We verified venues that were nominated using internet searches, and we narrowed the list down to 110 unique venues in Los Angeles County. About 2/3 of those were bars or clubs. Smaller percentages were service organizations, gyms or recreation centers, coffee shops, adult bookstores, and other types of venues. This is what our venue network looked like. We went through a series of matrix transformations, which I won't bore you with, but basically we turned a data set that was people by the venues they nominated into a matrix that was venues by venues, and then this social network visualization uses the spring and better routine. So venues that were more popular and more co-nominated were pulled into the center of the network, and those that were less popular and less co-nominated were pushed toward the periphery using spring embedding. And then we really wanted to know, is there a difference in terms of risk and protective behaviors between young men most identified with core venues or periphery venues? And so we split the sample that way using this K-core analysis. K-core represents a number of other nodes in a network, in this case venues, that a particular venue is connected to. So a 3-core, there are at least 3 connections to other venues in the networks. A 4-core, 4 connections, et cetera. So we took 3 or more core venues and separated them from 0, 1, or 2 core venues. And then we used the aggregate data from YMSM, either identified as peripheral venue attendees or core venue attendees, and looked at differences in their substance use. And we saw higher percentages of marijuana use, of illicit drug use, and of club drug use among those YMSM attending core venues. And while we didn't find any differences in terms of number of sexual partners between the 2 types of venues, we did find a higher percentage of recent STI diagnoses among YMSM core venue attendees, and also a higher percentage of recent HIV testing. So what does all this mean? Well, I think the first thing that we've demonstrated is that YMSM social spaces are highly interconnected. And we often think about these bars and clubs as individual standalone brick and mortar entities. But if we think about them in terms of social space, young men are crossing these venues in multiple patterns in the course of an evening or the course of a longer period of time. The results presented here are consistent in many ways with Stahl and colleagues' theory of syndemic production, which posits that as young men become more integrated into gay male community contexts, they experience both risk and protective factors. Higher background prevalence rates of HIV and other sexually transmitted infections, higher rates of substance use, mental health issues, et cetera, may create contexts that are risky. But these socialization venues play a very important role in the lives of YMSM as well. They are places where young men who often come from areas or towns that are homophobic or where they've been ostracized have the ability to affiliate with similar others and gain social support. In previous work, we've demonstrated that YMSM want to receive HIV prevention information quickly, conveniently, and either delivered through their social networks or in the social context that they're already attending. And so if we think about these contexts as places where we're going to deliver HIV prevention interventions, it's helpful to look back and see what's been successful. And there have been mixed results in terms of HIV prevention interventions for MSM that have been delivered in bars and clubs. But I think our data demonstrate that it's useful to go back and re-examine these spaces as potential venues for HIV and substance abuse prevention and create new and innovative strategies within these contexts. There are many limitations to this work. The data is fairly old now, almost 10 years old, and we know that new venues open and close. They change in popularity over the course of time. We recently replicated this analysis with a set of young men that we recruited through the geosocial networking app Grindr and found a similar core periphery structure and a similar group of most popular venues, but this is still a limitation of this work. In addition, we know that virtual venues are becoming more and more important in the lives of young men for affiliation purposes. Websites, chat rooms, geosocial networking apps like Grindr are all places that weren't included as venues in this analysis. And because venue-based recruitment was used, the popularity of venues in which young men were recruited may have been overestimated, and of course this analysis doesn't include those who didn't nominate any gay social venues. So some conclusions that we'd like to put forward for discussion. YMSM who use substances and engage in sexual risk behavior are integrated into gay male social contexts. And tailoring prevention to capitalize on the socialization patterns of YMSM may be a key way of meeting them where they're at, so to speak, to use a social work term. In a paper that was published in Prevention Science, we showed that high-risk venues and low-risk venues are also connected. And so thinking about how venues might be used most effectively for recruitment and engagement in HIV prevention is useful for YMSM. Other strategies that may be useful are to engage bar and club owners in consortia who can implement public health interventions within groups of bars and clubs. Oftentimes we hear from venue owners that they're afraid that prevention messaging might be a buzzkill, so to speak, or not be conducive to good business, but really the health and well-being of patrons is especially important for good business. And so if we can partner with bar and club owners and bouncers and go-go boys and staff at these establishments, maybe we can become partners in prevention in that way. And so more research on the acceptability of this kind of venue-based HIV prevention for YMSM is warranted. Thank you very much for your time.
I might just ask a quick question, if I can. I was just wondering whether going to core venues was associated with being gay identified.
That's a good question. I'd have to look back at the data. So one thing that we found among YMSM who answered that name generator versus those who didn't is that those who did were more likely to attend gay bars and clubs. In terms of gay community identification, I think at some point we did look, but I don't have it right in front of me, so I'll refrain from answering exactly. But I'll look it up for you, send it to you.
Yep.
Hey, great. Is this on? Great presentation, Ian. Could you say a little bit about what you think your findings have to say towards venue-based sampling approaches for MSM?
Yeah, so this is something that we've thought about as well. The Healthy Young Men study used a very complex venue-based sampling strategy, a time-based sampling strategy that was very cost-intensive and labor-intensive. And we found it very interesting that really, when it came to our results, there were just a series of core venues where most of the YMSM could be captured at one point or another. And so thinking more carefully about venue-based recruitment for YMSM is something that I think is worthwhile. And one way to kind of do things differently or think about things differently might be to work in tandem with community advisory boards, which I know you, Brian, and our group in Los Angeles often does, to identify really the most popular places first, and then to kind of work outward from those places. So that might be one possibility, but I think it's something that definitely warrants further consideration.
Okay, we've got
Thanks for
another
the question.
Yeah, Daniel from Switzerland. I have a question because I've been doing a lot of research in risk behavior, and I get back to your operationalization of risk behavior. Am I right that actually unprotected sex is not included in your operationalization? So having many contacts is already part of risk, but you do not care about if protected or not?
Yeah, so there was data collected on kind of more traditional HIV risk behavior metrics. Unprotected anal intercourse was one of them. And we didn't look at this for this analysis, but that's something that we should definitely do.